Hello everyone, today we will be discussing the Clostridium difficile rapid testing. The one we will be utilizing today will be the C. diff Quick Check Complete Test from Abbott. The primary risk factor for C. diff occurs on individuals who have been taking antibiotics or shortly after finishing the medication, as well as a recent stay at a hospital or staying at a nursing home. Patients over the age of 65 with a previous infection of C. diff, and also a known exposure to the germ. Unfortunately, another risk factor is on patients who have a weak immune system, like having HIV or AIDS, taking any immunosuppressive medication, drugs taken for organ transplant, and or cancer patients. It is extremely important to recognize the symptoms for C. diff. The United States estimates about 500,000 C. diff cases per year. That means that roughly 1 in 6 patients will get C. diff again within the subsequent 2 to 8 weeks. Also, 1 in 11 people aged 65 years and older get diagnosed with C. diff and unfortunately die within 1 month. Symptoms for C. diff present themselves in the form of severe diarrhea, loss or decrease of appetite, fever, abdominal pain or tenderness, nausea and or vomiting. If you happen to develop any of these symptoms, you should seek medical care as soon as possible. Diagnostic tests. There are various diagnostic tests that can be performed, either a rapid test or a laboratory test to determine if C. diff is present. In a rapid test, the polymerase chain reaction tests sensitivity and detects the C. diff toxin B gene in a stool sample rapidly. Some of these rapid tests include the Prima system Clostridium difficile toxin A. Another is the Premier cytoclone A and B, Immunocard Clostridium difficile, and the one that we will be discussing today, the C. diff Quick Check Complete. There are also laboratory tests, one of them being the GDH/EIA, meaning they test for the glutamate dehydrogenase test in conjunction with the enzyme immunoassay test. This will rule out the presence of C. diff in the stool samples provided. The rapid diagnostic test that we will be discussing today is the C. diff Quick Check Complete Test from Abbott. This test detects the GDH and toxin A and B simultaneously, and the results are given and presented within less than 30 minutes. This test was developed and manufactured by the Tech Lab Incorporation. The C. diff Quick Check Complete Test differentiates patients with active infections from potentially colonized carriers by detecting the disease-causing toxins A and B in patients who are positive for the GDH antigen, which shows the organism is currently present. In order to run a rapid C. diff Quick Check Complete test, you will need the materials listed below. We will begin with the membrane device. This is individually packaged, a disposable transfer pipette, 22 mL of the diluent, 12 mL of the washer buffer, 2.5 mL of the conjugate, 3.5 mL of the substrate, 2.0 mL of the positive control, a small test tube, a vortex mixer and applicator stick, a timer, and of course, disposable gloves for handling the fecal matter. When ready, follow the steps below to complete the C. diff Quick Check Complete test. We will begin by adding the 750 microliter diluent to the tube. Then we will add 1 drop of the conjugate to the tube as well. Make sure to transfer the specimen to the tube. You can do that by mixing the semi-solid or formed specimen samples using a wooden applicator. Use the pipette to transfer 25 microliters of the stool specimen into the tube. Mix the diluent specimen well. You can do that by either vortexing the sample or repeatedly inverting the tube. Transfer the specimen to the sample well. Using the new pipette, transfer 500 microliters of the dilute specimen to the membrane device sample well. That is the small hole on the top right corner. We will incubate this for 15 minutes at room temperature. Now we will add the wash buffer and substrate to the reaction window. We will need to add 300 microliters of wash buffer to the reaction window using the dropper. This will be the large opening in the middle of the test. Allow the wash buffer to fully flow through the reaction window, then follow with 2 drops of substrate. We will incubate for 10 minutes at room temperature again. At this time, the results are ready to be read. Make sure to read the results promptly at 10 minutes in order to get an accurate reading. Refer to the product insert for detailed interpretation guidelines. The illustration I included will assist with interpreting the results. The first test displays 3 dots down the middle. This is a negative test result where C. diff is not present. The second test illustrates a line on the left-hand side of the 3 dots. This means that the C. diff is present. And the last one, it demonstrates 2 lines with 3 dots down the middle. The result for this is that C. diff is present and producing toxins. There are several benefits for utilizing the C. diff Quick Check Complete test. One of them is being that this is a rapid test and you can have results within less than 30 minutes. The C. diff Quick Check Complete test has an accuracy of about 90% and it's very convenient as the test works with any specimen consistency and with samples stored in transport media. This test comes at a low cost as well. The material cost per test for each of these assays are $11.50. Most importantly, this test is FDA approved. To conclude this presentation, the C. diff Quick Check Complete test detects the GDH and the toxins A and B simultaneously. This rapid test also helps providers diagnose and treat patients accordingly. C. diff targets all age groups and it is a debilitating disease. Treatment includes antibiotics. Even when treated with antibiotics, the infection may come back. Most importantly, in order to prevent spread of C. diff, make sure to wash your hands. These are the references that I utilized to complete this presentation. Lastly, this is how Clostridium difficile affects the stomach lining. I hope you guys enjoyed this presentation. Thank you very much.